Dr. Jerry Jones is with us, and he works through Regional Hospital here in Jackson, anesthesiologist, and interviewed Dr. Jones, heard about him from a friend who, not often do people brag about their anesthesiologist, or not that I've ever heard. Yeah. But I went to visit a friend in the hospital, and she was raving about this Dr. Jones. I said, you've got to meet him because she wasn't groggy. She came through this surgery. He does a different kind of procedure, and she was alert and everything else. And, her husband was planning on her being knocked out for 3 days.
He was disappointed.
He planned a golfing trip and everything else. He wasn't able to go on any of this. And so I wanted people to meet him. It's good to have you with us, man.
Thank you. What
is this procedure that you do, or how is it termed or caused?
Okay, so what we do they're called continuous peripheral nerve blocks. So a lot of people have heard of, say, an epidural, where we, for laboring patients and things. So, you slip a little plastic catheter like this, into the right place, into the back. Okay. And this is sort of the same thing, it's just away from the back. So it's more of a regionalized area. So you don't, for the epidural, that's great, it controls your pain from here, but it also means that everything from here down is numb. And you can't move, and that's all this. So this is sort of the same thing, but just at a distance. So sometimes we put it up by the shoulder and the neck, or the leg. Actually, we can put it on in the front for abdominal cases, and off to the side for chest cases. So it's basically just using numbing medicine, just like the dentist uses in your mouth.
Well, what it prevents then is me coming out of surgery having to take generalized medicine or morphine or whatever, stay knocked out for 3 days.
Right.
So people come out of here and they're recovering more quickly.
Right, that's exactly. So, and it's not just, the thing that got me into this was certainly that a lot of people have a lot of pain after surgery. I mean, that's pretty clear. We see that all the time. That's one of the things. So we used to just do single injection nerve blocks in a few places for orthopedic surgeries primarily. And we looked like heroes for a little while, but then at 2 o'clock in the morning, the nerve block wears off, and they're back where they started.
Yes.
And then they take all the pain medicine, they're hurting like crazy, they get nauseated, constipated, they don't breathe well, all these kind of things. So again, instead of using all those things in the IV or however else to control your pain, you're just using numbing medicine in a particular place.
Particular area.
Right.
So if I got a surgical cut, then you just take care of that area.
Right. We find out, it depends where the surgery is, and then I'm going to put this catheter under the skin using ultrasound, so I can see exactly what's going on. I can put the catheter right where it wants to go. I'll put the numbing medicine in. If you normally just put an injection of local anesthetic in, that's great, but it's going to be gone in 6 hours, 20 hours. But, with this, we can leave it in as long as we need. 2 or 3 days is usually what most people need for most procedures, but I mean, there are some cases that we leave them in for almost a week. Wow. People can take them home with them. So
how did you figure this out then? I mean, because not everyone is doing this.
No, it's still pretty cutting edge. I mean, it's been in the literature for a little more, maybe in the last 10 years or less. There's some academic places that are doing it, and it's just one of those where I was just at a point in my career where I needed the next challenge, and
He's such an old man.
Yeah.
I'm just tired of doing the same old thing.
Yeah. So we were doing these single injection nerve blocks, and I just, you have family and friends, and just you see people, and they look great for a little while, and then they're awful. It's just terrible. Yeah. This was coming around. It's just something I got into and started looking, and then once I started seeing it, so it's pain control. That's what made me get into it. Once I started seeing the reactions, it was like I stepped out the back of the wardrobe into Narnia, and I can't. It's not this. It's a little bit better. It's outrageously better. And you might think I would say that because this is what I do, but I mean, I was just in the intensive care unit very recently, and I walked in at the same time that a patient's family members were walking in to check on this patient. Well, the patient was walking around the ICU with a physical therapist, and they had just had surgery less than 24 hours ago. Wow. And just seeing the surprise and the smiles and everything on the family's face, like, how can, it's not a little bit different. So it's not just that pain control so much better, it's optimizing things. This is somebody that's already doing recovering, the bowel function's coming back faster, you get out of the ICU faster, you get out of the hospital faster. Yeah. So there's all kinds of implications besides just best pain control.
Wow, that's amazing.
If you look up in your anesthesiologist, it's not Jerry Jones, and you say, hey! It's very good to see you.
You might want to change.
But it was amazing stuff. I appreciate you taking time to share with us. Merry Christmas, Doctor. We appreciate it very much.